Hello, everyone. A very good evening to all of you. Myself, Dr. Jamuna, heading Clinical Excellence and Research Team at QurHealth. I welcome you all for today's webinar session on Mind Care, addressing new age mental issues. Our guest speaker for today is Dr. Safiya, a famous psychiatrist in Bangalore. Let me introduce you all to our company, QurHealth. QurHealth is a conversational AI company delivering personalized care at scale. Our vision is to save lives super proactively. Our user-friendly app, QurBook, has more than 2,500 care plans and diet plans under 30 different specializations. These plans will help to improve patients' health condition by monitoring their vitals, symptoms, and everyday lifestyle management activities specific to disease condition, and also via AI Sheila in the app. Our Care Concierge program consists of expert care team with specialist doctors, dietitians, psychotherapists, physiotherapists, then counselors, and also highly skilled nurses who will be acting as your care coordinators. They'll be remotely monitoring your health condition through regular follow-up calls and make sure you adhere to the plan activities and take medication on time. Along with that, eat healthy food, which is listed in your diet plan. Before we start today's webinar, I would like to introduce you all to our guest speaker. Dr. Safiya is a renowned psychiatrist with more than 17 years of experience, and she is the founder cum medical director of Mind and Brain Hospital in Bangalore. She's very passionate about psychiatry, and she believes in a holistic approach integrating psychological, biological, emotional, and social well-being of an individual. She's a visiting consultant at Kaveri Medical Center, MedStar Hospital, Northside Hospital, as well as Apurva Hospital. She actively participates in de-addiction programs and is associated with VK Rehabilitation Center and Yashoda Foundation. Usually, in traditional practice, psychiatrists would diagnose a psychiatric illness and then give medication. Post that, psychologist or a psychotherapy counselor would counsel the patient and give therapy. But Dr. Safiya is working towards bridging this gap, and she has dual degree in psychiatry as well as psychology. We are very honored to have you with us today, Dr. Safiya.
Thank you for that introduction.
Yeah, I would like to inform to all the viewers that you can type your question in the comment section, and these questions will be answered at the end of the webinar during Q&A session. This will be conducted by Dr. Isha. So let's begin our session for today. Mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and the way we act. It also helps determine how we handle stress, relate to others, and make healthy choices in life. Mental health is very important at every stage of life, from childhood and adolescence through adulthood and old age. According to World Health Organization, an estimated 1 in 8 people globally are living with a mental health disorder. That is, approximately 970 million people around the world are living with mental health disorder, with anxiety and depression disorders being the most common. In India, prevalence rates for psychiatric disorders vary from 9.5 to 370 per 1,000 population. Our Indian government is taking necessary measures to prevent mental health disorders and to enable necessary treatment via national mental health programs and policies. Out of the total 86,200 crores allocated health budget for 2022 and 23, around 1,035 crores are funds which is exclusively allocated for mental health. Hence, mental health and well-being has become a global priority. Today's webinar session will provide a detailed insight into the cause, cure, and prevention of new age mental health issues. Dr. Safiya, please let our audience know the types of new age mental health disorders, their warning signs, and their effects on physical health?
So post-COVID, I think mental health has got a good amount of attention. That's a very good sign. So one basic understanding we all should have when we talk about mental illnesses, the differences what is there between a mental wellness and mental illness. How do we kind of differentiate between this? And then we could probably talk about the types of it. So all of us do have mental health, like how physical health is present, like how we can see we're walking, we're talking, our hands are there, our legs are there. So that's visible aspect of our existence. So the validity of the physical illness is much more. Similarly, there's a mental health as well, which is invisible mostly. So the mental illnesses comes as an invisible illness most of the times. So being positive, sleeping well, eating well, being able to be productive, having a good focus and attention, ability to handle your emotional regulation. These are all the part of mental wellness, which all existing human beings should have. So when do we call it as a mental illness is when there's a deviation from this normal functioning. So the symptomatology could be some change in the biological function itself, like you are not sleeping, you're not eating, or you're eating more, or you're sleeping more, or you're not having a proper interest in doing anything. So it could be as biological as that, where your basic function is kind of affected. So that is one of the warning signs that if you're not sleeping well for a long time, if you're not eating well for a long time, if you do not have energy for a long time, so that's one of the physical bodily symptom. It could be a cognitive symptom, like you're not focusing, you're not able to be give attention to one thing, or you're giving too much of attention to too many things, like you're getting into the too many details of things and you're not really able to complete it. You're forgetting things, or you're kind of looking at many things, many number of times. So it could be a cognitive problem, a biological problem, or an affective problem. Affective meaning mood-related problem. You're very happy or very sad, or you are not at all feeling any emotion, or you're getting emotions which are not existent, like you're kind of becoming very paranoid about something. So it could be a behavioral problem, or it could be an emotional, like violence, aggression, anger, shouting, irritability. At one end, it could be that where it is too much, or it could be a withdrawn problem. You're not talking to anybody. You're not coming out of the room. You're not making an eye contact. You're not able to communicate. You're not talking at all. You're not at all able to verbalize what you want. So the symptomatology can come in different formats. So for an initial evaluation, for us to identify whether I have a mental illness, we need to kind of categorize and understand that any of these areas are affected. And another area when it becomes mandatory for you to meet a mental health professional would be when there is an interference in your social life, like you're not coming out of the house, or you're all the time outside the house, you're not coming inside the house, or you're not able to go into work, or you're not able to function as a normal, what is expected of you. So when there is an interference in your social life or occupational life and your functionality on day-to-day life is when you will have to consider meeting a psychiatrist. There must be some problem which may have to be categorized into a group and then be treated. So having said that, so once a person comes to, is aware, okay, now there's a problem and he comes to us, then we look into whether this is coming from a problem where the person is aware of the reality, that he understands, yes, I have a problem. That is an insight into the problem. So some category of an illness will know that there's a problem. I have a problem. So then that becomes more of aware problems, okay, that I have a problem. So there are illness where the awareness is very high or insight is very high, like anxiety disorder. I'm getting very scared, I'm fearful, I am getting very edgy, or I am not able to face a situation. So the individual recognizes that there's a problem. So that is one end of the problem. There's another end of the problem where the person absolutely not recognize that there's a problem. Like, he may be thinking somebody's going to kill me, somebody's following me, somebody's talking to me, somebody is trying to harm me. And with that, he may be going to harm somebody else. So there's an absolute lack of insight. That's another end of the spectrum. So these are the ways we have to categorize whether it is somebody which is coming from a neurotic background or a psychotic background. And another larger chunk of problems comes related to substance use. Like there may be a behavioral problem which is coming after the use of an alcohol or a cannabis or any kind of another drug related. So it could be a drug related problem. There could be changes in the behavior, in the attitude, in the cognition, in the biology, all of that after the use of a substance. So that's another chunk of the problem. Another area which we need to look into is an organic problem. There could be something else going on in the body, like there's a tumor in the brain, or there is an infection which is untreated. There could be some metabolic problem like an acidosis or anything like that, so which kind of leads to psychiatric problems. So when you ask a question like a new age mental health problem, so new, if I have to say, I could probably say, okay, now more aware problems, or some new problems could be related to more to substance, which is coming up more than before. And then, of course, now related to social media and the usage of the gadgets and other things, which are also coming up as a mental health problem, which could come up in different layers. It could come as an adjustment problem. I'm not adjusting, I'm not sleeping. 2, I want to die. I want to commit suicide. Suicide also is increasing very high, and in the younger generation, the self-harm tendencies have increased, and the incidences of committed suicides are increasing. So that I will call it as again a new age problem, which needs a complete attention.
Yeah. Yes, doctor. So as you mentioned all this, we will go in detail of each and every kind of mental health problem one by one. And starting with World Mental Health Report, it says that around 1 in 7 adolescents have mental disorder, which accounts to around 13% of the global burden of the disease among this age group. So now, doctor, which are the most common mental health issues among these teenage groups, and how should the parents identify and help the teenagers?
When we look at common mental health among adolescents, the anxiety disorders are more common compared to other issues. And as of now, I think the usage of substance have increased tremendously. So substance related problems are another areas which a parent should be aware of. With respect to mental health disorders, anxiety mostly comes in the form of decreased performance in the college, or inability to attend the classes, absenteeism from school, inability to have a meaningful interaction with the peers. So having a poor social, life. So those are some of the warning signs that the parents should be aware of. If you find your child being very withdrawn, if you find a child not going to classes regularly, or unable to complete their academic expectations, or is not showing good enough signs of social interactions, that's one aspect. Another aspect is that your child is being very defiant, not being oppositional all the time, not able to communicate effectively, not able to kind of make an eye contact with you, or unable to participate in the day-to-day activities, not sleeping well, not at all eating anything, So having some kind of behaviors which are different, like hiding and talking on the phone too often, any cut marks on the hand, all these signs parents should be observant about. Sometimes the physical symptoms of substance use should not go unnoticed, like redness of the eyes and very droopy face, having needle marks, cut marks in the body. So This and all parents should be observant about. Suddenly, if your daughter is all the time wearing full sleeves, that's also another sign. Maybe you should open and see what's happening under the sleeve, because sometimes there are cut marks. And very commonly we see in adolescents self-harm tendencies. So these are the things a parent should be observant with respect to behavior, attitude, dressing, their way of approach. All that has to be looked into.
Okay, doctor. And also in recent times, youth are at an increased risk for behaviors that can lead to poor health outcomes. Like already you have mentioned about substance use. So what are the exact consequences of substance abuse, and how to help youth to overcome these conditions?
The consequences of the drug abuse are many. Now that depends upon what level of drug abuse is happening. So drug abuse is categorized into 3 or 4 types. So the child may be in an experimentation stage where they're just using the substance, like they may be trying out a cigarette, or they're just trying out an alcohol. They may be in an experiment stage. Many of them do drop out, and then they go, they don't like it and they just drop out. So then that's okay. Experimentation happens and that's fine. Then they could be use, which is well in control, like weekends or with families, or, it is not impacted their life anyway. So that's also fine. Then that doesn't come under a problem behavior. It's a usage. Okay. So then the problem behavior comes when the usage becomes misuse or abuse and dependency. So the consequences of misuse and abuse could be that you are taking more than required. You are not attending to the things which you're supposed to attend, like going to classes, or completing your homeworks, or having meaningful relationships, learning and things like that. That could be the consequence. And there could be health consequences which can happen, like it could be stomach issues, liver issues, gait issues, in the sense balancing issues, slurring, and memory issues. So that could be with respect to abuse and misuse, which is more than a use. The actual problem comes when the substance abuse becomes so illness, where it is dependency. Now you become very, very dependent on it. You're like, you can't focus on anything other than the drug. Your life revolves around the drug. You can do anything to take the drug, and you will have withdrawal symptoms when you're not taking the drug, and your resistance and your tolerance level is much more higher. So these are the signs when it is having a huge consequences. The consequences could be social, where you are not talking to anybody, you're doing nothing else other than drinking, you're confined to your room, you're confined to your home. There could be legal problems. You start peddling the drugs and you get into police issues, legal issues, you hit somebody, you kind of have problems interpersonally. That could be legal consequence. Finance, of course, there's a lot of loss of money, loss of things, of financial loss, and more so health loss. The consequence health-wise can be quite dangerous. The possibility of a depressive disorder, possibility of a personality issues cropping up, all this becomes more and more, and your decision making is compromised. Your judgment is compromised. You're not able to judge between what is right and wrong. You're not able to make appropriate move as to what should be my next decision so that I can plan my life. That could be one of the bigger consequences. And then when it comes to body, your brain's having deficiencies like vitamins deficiency, vitamin B12 deficiency, which can further lead to neuronal damage, which can lead to memory issues, then it can lead to degenerative issues, and later on higher possibility of dementia and seizures and other aspects. Then there could be problem with the liver, there could be damage in the liver, there could be cirrhosis, there could be other issues like your pancreas can get affected, your all the metabolic functions can get affected, and the person taking substance are at a higher risk of getting metabolic syndromes like diabetes, kidney issues, and all the other physical symptoms. And generally, there could be more of weakness, and your stamina can come down, your ability to have a normal functioning physically can be compromised. There could be a compromise on your sexual functioning and reproductive abilities. So all those things could be the consequence of substance use.
So how do they overcome these conditions, doctor? Do you recommend direct counselings, or they have to be put on rehabilitation?
So as I said, we could categorize the substance use into different layers. If at all the child is in experimental stage and use stage, that's the right time to catch them, meaning to kind of talk to them, have a better relationship with them, in the sense parents can talk to them, have a little more friendlier approach, take them into confidence, and at the community level, at the family level, at the school level itself, we can encourage them, motivate them to come out of that habit. And if at all it has gone to an abuse state, also we could do a lot of work at the community level, where the counseling per se may not be needed. Family and school and others could do a good job by talking to them and training them, developing their other skills, making them have a hobby, and make them focus on something else or enjoy something else apart from the drugs. But if they are into a dependence mode where there is total preoccupation with the substance, then that's when the medical interferences comes into picture. Definitely, they will need counseling, they'll need therapy, they'll need medication, all of that. So when do you consider rehabilitation or an in-house facility, or you kind of treat that person inside the in a closed facility, is when that person is totally lost inside. They don't know what they're doing. They can harm themselves or harm someone else, or they're totally into a negligent mode. That's when the rehabilitation comes into picture. The choice of treatment is based on the stage of the problem.
Okay. And like you already mentioned about the suicidal cases, doctor, as per the reports, we see that more than 7 lakh people die every year due to suicide. So this accounts for 1 in 100 deaths globally, and is the 4th leading cause of death in individuals aged among 15 to 29 years. So what are the factors that usually contribute to the risk of suicide, and what behaviors should be considered as the warning signs?
Yeah, suicide is a very complex phenomenon, and it's multifactorial. So if you look at the causes of suicide, most common causes of suicide is societal in nature or social in nature. Like it could be poverty, it could be financial crisis, it could be relationship problems, it could be something to do with family issues. So mental health issues, substance related issues are one of the factors of suicide, but that's not exclusive causes of suicide. So suicide it's not only a medical problem, it is also a social problem. So you should be able to differentiate. Now, if at all somebody is going through financial crisis and death was the only way, then it's more of a social issue. So maybe recognizing those things by family, friends, and people around the community is necessary. So that's more of a social issue. Then when it comes to a medical issue, depression is one of the most common cause of suicide. Depressive disorder, substance-induced issues, psychotic disorders, these can cause, this can lead to suicide if it is going untreated. So as a protective factor, we have to be able to be vigilant about people who can commit suicide. So we should see for the red flags, like that person is not any kind of symptoms, like they're not sleeping, they're not eating, they're not talking, they're not working, they're not coming out in public, they're not talking appropriately, there's a lot of inappropriate communication happening. So there's a lot of things which can lead to the red sign, the red flags could be seen. So if we are observing a person is behaving differently, or he is withdrawn, or he is crying too much, his vulnerability is visible, somebody is very restless, somebody is showing signs of losing a lot of weight, not taking any interest in themselves, So any of the signs, when we see that that person has now become a little different, I think each one of us should be able to have the ability to ask for it, as if, how are you feeling? What are you doing? Is there anything wrong? Can we talk about it? That itself, the ability to initiate a communication, ability to have that initial conversation with any human being around us. We never know who is going through what. Like if at all we see somebody down, I think we should make it a habit to ask them, what is it? So that's the first protection. As a community, I think we are losing that. We are only on, that interpersonal bonding is going. So I think one of the protection, the prevention is to have a better interpersonal skills. And if you recognize anybody who is going down, to ask them and talk, if possible, take them to somebody so that they can communicate, coordinate with people around them and uplift them, reassure them, help them if you can. And, many a times a listening ear is more than enough. We just want somebody to listen to us, validate our emotion. Yes, we can understand. We can see it. We can see you. We can see that there's a pain, but nothing is so difficult. Let's talk about it. Let's see what is the thing. So this small skill of being able to listen to somebody, able to reassure that person, able to refer that person, can bring in a huge change in the suicide prevention strategies. And that's one of the main strategies where every individual should be able to do as a gatekeeper. And if any individual is going through some kind of a distress, it's always nice to go talk to somebody. It always lightens you up. And protective factors are families, definitely. It's something which is unquestioned, a very supportive family, very loving family, a good education, having a social life, not using substance, having a well resilient personality, ability to deal with life challenges in a better way. These are all the protective factors to prevent suicide.
Yeah, true, doctor. And you had also mentioned about these dating apps. One of the recent study has revealed that these dating app users report lower self-esteem levels. And they also have reduced psychosocial well-being compared to the non-users. So what are the negative impacts of these online dating apps on mental health?
So with the surge in the number of dating apps, the younger crowd is kind of trapped in, yielding to their immediate gratification, So they are gratified very quickly. You are attracted to somebody, you're just getting an access to that person. So there is no time, or the brain do not learn to process the information and then take a decision. So because of the continuous immediate gratification activity, you lose the sense of decision making. With over a period of time, you also lose the patience. And then you kind of tend to become very impulsive and very, you just act. So with that repeated behavior, you definitely lose the patience, and which impacts your, concept of self. That's one. And because the whole area of dating app is so, it is a little fishy, right? Who is coming in and what is their intentions? What are they looking at? So everything is not clear. So they can get into a lot of conflicts, and they may not have the good enough ability to resolve those conflicts, because of which their mental health situation can become worsened. So who goes to these apps? It's not necessarily with only people with a lower self-esteem would go. Everybody whoever would want to experiment would go, but who will yield to it or who will get trapped in it are the people who may have less assertive capacities. So those who have less ability to tell a no, they tell yes to everything, and because of that, they get into more and more problems. So children who are less assertive, vulnerable, superficial, shallow in their thought process, they are the people who will be more vulnerable to be trapped in the dating apps, which can have its own consequence with respect to their mental health.
Okay. And then coming to workplace environment, doctor, nowadays working conditions and workplace environment, they can have huge impact on mental health. And also the evidence suggests that around 15% of working age adults were estimated to have mental disorder. So what do you suggest to these employees or working population, how to overcome the workplace related mental issues?
Yeah, workplace related mental issue, again, there can be a range of it, right? So workplace, it could be performance based, that, and everything related to performance, like you're not able to do your job, you're not getting your hikes, or you're not able to be promoted, or whatever the pressure they are coming up with. So that could be one of the area of performance related anxiety. Skill deficits, inability to learn or acquire knowledge, which is leading to poor self-confidence, that can lead to anxiety. That's one aspect of the problem. Another aspect of the problem in the workplace is social relationships, because it's highly intensive, dynamic environment. There are a lot of exposures to a lot of things. Like you have to deal with your boss, you have to deal with your colleagues, you have to deal with your juniors, you have to deal with people from the opposite gender, a lot of policies and a lot of things around. So the issues could be related to those as well. So two different aspects of the problem. One is related to your performance and skill sets with respect to your job, and another one is related to your social skills with respect to job. So it's very important for each one of us to understand what are the deficit areas, what are the areas which we're struggling with. And nowadays, most of the corporate companies do have counselors and other support system. So it's very important to talk it openly to people, to what are the areas which you're struggling with. And then, that can help you to kind of at least have a clarity, what is the problem, and how do you go about it? If it's a performance related problem, maybe there is some kind of a solutions like improving your skill, improving your way of work. If it's social related problem, you have to work on social skills, communication, ability to have a better relationships, have a better leadership ability, better assertive skills, tell no often, know where to have a boundary, where to tell, cut off with other things. So all this comes as a skills in the workplace.
Yeah, and moreover, since this COVID started, doctor, like most of them are working from home, right? So they are very less interacting with their peers, right? So previously, when everyone used to go to the office, they had the opportunity to talk to each other, share their feelings. If they were under some stress, they just sharing it, like you mentioned, talking to someone will really help. So that was a kind of relief that was happening when like employees used to work at the offices. And now, because of this work from home culture, do you think that this has also affected in some or the other way the mental health of the employees?
Work from home opened up a lot of opportunities, in the sense, you got a lot of time with your family, you got a little more time, proximity to many things. So I see that work from home has helped many people with respect to those who had anxiety disorders and all. Actually, it benefited them because they didn't have to face people and other things. But post that, when now people have to shift from work from home to work from office, there is a transitional problem. But did work from home affect the mental health? One category of people, it really affected their mental health, who thrived on social life, who kind of wanted that, exposure and people and laughter and everything. They really had to go through that kind of isolation, which really affected them very badly. They felt trapped inside the house, and many of the marital problems increased because of that, because most of the time the couples didn't have the skill to deal with each other, but they had the skill to deal with the entire world. But when work from home happened, many marital problems started, interpersonal problems within the family started, which also impacted the mental health of many. And then, yes, that isolation did have an impact on many people as to, because they didn't have a point of venting out.
Yes, doctor. And I would also like to discuss regarding the school children. So most of the parents nowadays report that their children are experiencing a lot of stress at school. And do you think, Doctor, the current education system, the kind of syllabus and the pressure they have, is it affecting the child's mental health?
So I don't think syllabus or this education system to be blamed, because that's a system which has been followed from many years. It is a debatable thing whether should we change the syllabus or not. That's up to the education department. But I think it is again the stress comes from the individual children. Children mostly not able to handle that pressure. Many of the children may have a learning disability, may have an underlying problem like ADHD. They may have problems related to communication, anxiety disorders, depressive disorders. So people, and many of them may not have enough family support. They may not have a good environment at home. A lot of factors makes the child more vulnerable. It's not the system which is a problem. Yeah, there are some systemic problems that is beyond our area to work on. And our opinion probably may be biased because we are judging that, we don't know what it is. But then when we look at the problems, it is coming from an individual variables. Like as a person, there may be variables, there may be kind of issues which the child is not able to handle, like the academic pressure or ability to deal with the social challenges like bullying or all that. More than the education system, the environment in the school matters. What kind of teachers, how they are communicating with the child, what kind of policies the school have in place for bullying and sexual abuse and other things. So those things matters a lot. And even if there is this education pressure, how the school is managing with that, how they are providing the resource, what kind of a special aids the school has to help those children. All this matters when it comes to stress of the child. The school is not well prepared with a counselor, with a special educator, with an alternative mechanism of education, that adds into the stress more. So it matters on the individuality of the child, whether the child is vulnerable, and the kind of school or the teacher and the system and the resources they have. Then also the syllabus. All these factors plays a role in this child mental health.
Like you also mentioned ADHD, that is attention deficit hyperactivity disorder. This has also become one of the most common problem among children in recent years. So what are the actual causes of ADHD in children, and is it hereditary? Can this be cured?
So ADHD is a neurochemical mediated problem. There could be multiple reasons for ADHD. ADHD could be because of the early birth traumas like hypoxia, early seizure disorders, or any kind of insult to the brain, or any kind of nutritional problems in the early part of the childhood. So it could be even hereditary, but it mostly is caused by some kind of a neurological developmental issue. It could be associated with other developmental problems like speech delay or having any kind of other changes in the development. So it requires interference, a medical model where some of the children may do well with medication. Some of the children will do very well with behavioral therapy, family therapy, school. School has a huge role to play in children with ADHD. If the school have an alternative mechanism like a shadow teacher or a special educator or a SEND room, which is special educational need room, and then they have a mechanism to handle these children, then the recovery becomes easier. So whether it can be cured, that depends upon what is the degree of the problem, whether it is mild, moderate, or severe, and what kind of interventions we have chosen. Did we choose medication? Did we choose therapy? Did we, school help? All that matters. But what works the best is a multimodal approach where there is a medical interference, there is school coming into picture, parents coming into picture, having a social treatment where then in the sense, making him play more sports and expose the children to most of the social activities. In that way, if we have a multimodal approach, the recovery is higher. So can it be cured? That again depends upon the level at which it is affected.
So like ADHD, most of the children are also having this autism issues. So it is estimated that around 1 in 100 children have this autism. So what are the steps that can be taken if a child shows the sign of autism? And can these children be sent to regular schools?
So autism is a social communication problem. The child has basic problem in the social life and the communication levels. So as an intervention, we have to kind of have a therapeutic intervention where the child's speech, language needs to be taken care of. Their social life, emotional challenges needs to be treated, like there need to be behavioral therapy to work on their emotional regulations, how to regulate themselves, how to kind of handle themselves. There has to be a good amount of emotional regulation skills, which should be done by a behavioral therapist, and a good amount of they should be able to handle their bodily changes which happens. So different type of therapies like speech, behavioral, occupational therapy, sensory integration therapy, a lot of different types of therapies are required to help them. So if the therapeutic approaches goes on in the right way, there is a higher possibility of a mainstreaming of schooling. Like, they know how to sit in the classroom, how to kind of have a, meaningful communication with their peers. So if active intervention has happened, then there is a possibility that they can be mainstream. But if there is no interference, like if the aggression level is higher, they are not able to be in a setup which has other children, and then it becomes difficult to mainstream them. Then they will probably have to go to an alternative school.
Like I already mentioned at the beginning of the webinar, doctor, like anxiety and depression have become the most common mental disorders now in the world. And research also states that worldwide 301 million people were living with anxiety disorder, which includes 58 million children and adolescents. Likewise, depression cases are very high. Then chronic insomnia, this is also very high, and it has become like a global epidemic which threatens the health and quality of life up to 45% world population. So doctor, for these major conditions, how is the treatment available, and what kind of counseling sessions are being given? And first thing is, how do we diagnose this? So which is very, very important.
So, as I said in the beginning, so we'll have to look into what are the areas which is affected. Like if at all a person, now sadness, somebody says I'm sad because weather is not good, or I'm sad because I'm bored. So that is not equivalent to depression. Okay, if someone says that, okay, I had a breakup and I'm sad, that also is not depression. That is sadness, or you're upset. But how do we diagnose a clinical depressive disorder is where there is a decreased interest, decreased appetite, decreased pleasure, they're not able to relate to anything. You're not able to sleep, you're not able to eat, you're not able to do any of the things which you otherwise generally would do without any particular reason. You may not even have a trigger, but there could be a downhill, and it goes on for more than 2 weeks. More than 2 weeks, the symptoms persist, and it only becomes more and more. That you're not sleeping, you're not eating, you're not happy, you're not having energy, you're not having any pleasure, you're not enjoying anything, you're not even appreciating your existence. You would want to, you can question yourself, you feel very, very helpless, you feel there's no hope, there's nothing to look forward for, there is no sense of well-being in anything, nothing makes you happy, which otherwise would have made you happy. Maybe before you were upset and one ice cream would kind of solve the problem. Now even thousands of ice creams is not making sense. So when things starts losing its meaning and you cannot relate to things and it's deteriorating over a period of time, and it has significantly interfered in your social life and your occupational life, is when a diagnosis of a depressive disorder is made. And with respect to anxiety disorder, is when your restlessness and your overthinking, your physical symptoms like palpitations, you're having tremors of the hand, there's a sweating of the hand, there's a giddiness, a lot of physical symptoms, and you're not really able to deal with the day-to-day challenges, and which is again more than 2 weeks to 1 month, and it has significantly impaired your personality, is when a diagnosis of anxiety disorder is made. Typically for a diagnosis, a clinical interview is a first step where we kind of talk to the patients and kind of understand what is the level of the problem, and then diagnosed. So with respect to insomnia, there could be multiple reasons. It could be anxiety and depressive disorder, or any kind of other mental health disorders, or use of substance, gadgets, inability to handle the conflicts of life, not having the skill enough to kind of be resilient enough. All these things could be the reason, and that's how we diagnose. And as initial, after the diagnosis is made, the medical management is planned. Usually a medication is started, or the person is advised to go through a therapy.
Okay. Okay, doctor. So all this while we just discuss about the mental issues that the teenagers, adolescents, and children at school are facing in their day-to-day life. Now, I would like to also discuss about the elderly population. The mental health and well-being are as important in older age as at any other time in life. Approximately 15% of the adults who are aged 60 and above suffer from some kind of mental disorder. So what are the factors, doctor, which really affect the elderly population? And how is that these people have to overcome their mental issues?
So geriatric mental health is another area which needs a lot of attention. In geriatrics, mostly we'll have to look into the comorbidities, like what else do they have apart from the mental health? Like if they have any chronic issues, like metabolic problems like diabetes, hypertension, or underlying cardiac problems, or any other illnesses, the possibility is higher because their health is compromised. And also social factors plays a huge role. The kind of house they live in, whom they live with, the loneliness, helplessness increases because their mobility is compromised, their decision-making memory is compromised. So not having a good support system can also increase their depressive symptoms or the anxiety symptoms. Other organic problems like tumor or any kind of infection and any kind of a metabolic changes also leads to depressive disorder, different mental health disorder. So as the elderly, neurological problems like dementia, issues related to psychosis also increases in thing because they don't have much stimulation. They don't go out, or they don't have any kind of a connect in the outside world. Then also the psychotic illnesses and this can increase. So a very thorough investigation is necessary in elderly, like an MRI, blood investigation, ruling out all the other problems is very necessary before we diagnose geriatric cases. And the most important thing for geriatric people is support. So there has to be. Now, very sadly, we see more and more elderly care homes and all are coming because family is not able to take care of their elderly. But that itself can be a big problem where it can affect their mental health, and existential crisis could come into picture. That where am I going? What is happening to me? What will happen next? Will I have a support? Will everything be okay? That kind of cognitive changes can come in, and they could have complications. Suicidal thoughts can be high in geriatric population too. So it's very important to take care of elders.
Yes, very true, doctor. And despite of having overwhelming evidence which shows that psychotherapy works in most of the 93% of the cases who have mental health disorders, many people are reluctant in approaching the psychiatrist or the doctors or the counselors. And so what do you suggest to these people suffering from mental health?
See, our ability to see mental illness as a physical illness. Our brain is a part of our body.
Yes.
Brain is in our body, and mental illness happens due to the brain. So the more and more we equate the mental illness as a physical illness, like if you have a fracture of your bone, you would definitely go to an orthopedician. If you have fever, you would go to a physician. If you have overwhelming feeling like you're crying all the time, or if you're not concentrating on studies, or you're not able to deal with your own thoughts, that's also coming from the body. So body has something to tell you, and there's somebody to listen to it. So treat doctors like psychiatrists, psychologists as specialists who would not judge you. Nobody is going to sit and judge you. They are going to treat you. So the more people understand it is a correctable problem, there's nothing to be bad about it. You don't become a bad human being because you have a psychiatric problem. You are not weak in any way. I would say people with mental illness are much more stronger than anybody else. So nobody is judging you as a weak person or somebody who is possessed or somebody who is not capable enough to deal with their own problems. No. The moment we change our narrative and the way we look at it, I think it becomes easy to access. And thankfully nowadays, number of psychiatrists, psychologists, everybody is increasing. People are available online. Just talk to somebody. I think that will really help.
Okay, so finally, doctor, can you please suggest the right practices that would help our mind stay calm and healthy, not just for a short period of time, but throughout our life?
So I think be simple, don't complicate your life, and try to find happiness in small things, and be true to yourself. I think if that's there, I think life becomes very easy. You don't have to complicate it by doing too many things. And that can give you a lot of peace.
Thank you, doctor. So we discussed in detail about all kinds of new age mental issues. Now I would request our expert dietitian, Sutapa, to highlight on the significance of diet in combating mental health issues. Actually, Sutapa comes with more than a decade of experience in the area of diet and nutrition. In our team, being a part of QurHealth family, she has successfully formulated more than 500 diet plans under 30 different health specializations. So over to you, Sutapa.
Hi, good evening and everybody. Dr. Safi, it was a great session. So I have been practicing as a dietitian for more than a decade now, and I would like to share some inputs. Like a diet can play not only a role on physical health, but it does play on mental health too. So there is a very broad spectrum of diet, as we can see. In the nutritional psychiatry, there is also some correlationships between what we eat, how we feel, and how we are representing ourselves socially. So I would like to talk some very basic nutrients which are absolutely directly related to the mental health. So let's talk about first serotonin. So I'm sure people are aware of these terms because now we have internet with us. So serotonin is a neurotransmitter. 95% of serotonin is produced through our gastrointestinal tract. So what does this serotonin does? So it modulates our appetite, our sleep, and it mediates our mood also. So basically, GI tract is not only absorbing or digesting our food, it is also guiding our emotions too. So basically, if we incorporate some legumes or amino acids and nuts, seeds, dairies, and pineapple, these are also very, very good source for serotonin functionalities. Then next talk about dopamine. So dopamine, as we call about happy hormones, because it gives whenever we achieve something, if we are achieving some promotion or something award, so we feel good because we have a surge of dopamine in our brain. So obviously there are dietary aspects also to increase the dopamine, as it takes care about our mood, our good feeling, everything. So nuts and seeds are the best sources for dopamine secretion, and amino acids. So amino acid has been proven to be a great source for dopamine enhancement in the body. So as we know, amino acids is linked with protein. So any lean protein, legumes, if even for the vegetarian people, they can opt for dairy, cottage cheese, yogurt, curd, everything will be a very great source for the protein purpose. And for non-vegetarian, animal protein is anyway the best source for amino acids, but we just need to take care of the lean meat rather than the red one. So coming to the next part, which is a micronutrients. So as we all know that micronutrients has been a change maker for almost all the health hazards. So unlike that is also, they have a role in mental health also. So let's talk about magnesium. So that's a very minute recommendation we have per day, but still it has a miraculous activity in our body. So basically magnesium, if we take magnesium properly, it takes care about our anxiety and it reduces the stress also. So it's basically takes care about the entire body's stress responsive system. So magnesium is very rich. We can find every day, maybe we drink or we take somehow or the other, that is called dairy. Dairy products are very rich in magnesium. So a simple addition in your diet, you can just take a lukewarm milk just right before you go to sleep. It will give you much better sleep and resting state. And you will be in a peace of mind, and people who are with insomnia, they will get a magical impact on this. It's very small changes. So stress eating, emotional eating, whenever we are depressed, we eat. Whenever we are not good, we find restaurant food is very good for us. It's all are very common phenomena of depression, anxiety, low confidence, and everything. And binging on unhealthy food, in spite of knowing that this is unhealthy, but still we feel good. This can be modified with the proper guidance of mental health diet plans that we have actually prepared in our it is presented in our QurBook application. And make sure your timing for your meal timing is scheduled, your dining ambience is fine, you're at peace while you're eating. Such things will definitely influence your mental health. And coming to the, I will end here by saying that you can subscribe our QurBook application, because we have a magically very effective mental health diet plans, because we have been taking care of all the very basic key points of entire mental health guidelines, as I just mentioned earlier. So even you can take the diet consultations with our team for the better understanding, because I feel diet is very, very personal. So we make it generalized and we make customized also. So as it is very personal approach, so you can talk to our very expert team, and you can further, whoever wants to take a better care of their mental health, they're very much welcome. Thank you.
Thank you, Sutapa. Now I would request Dr. Isha, our marketing and communications leader, to conduct the Q&A session.
Sure, Dr. Jamuna, thanks. Dr. Safiya and Sutapa, it was a great session, and I think so the audience is taking a lot of information today and insights. And I do believe, yes, mental health is something that has been around, people know about it, but yes, we sometimes miss it and we end up with issues. So quickly, as we are running out of time, I have few questions that audience has asked Dr. Safiya. One of the very important question I will say around here is, those who have been infected with COVID, are there any specific mental health issues that they may suffer from? I think so this kind of question is arising in mind of many of the people who have suffered from COVID. And they would also like to know if there is anything that they can do to prevent it, or can do something to improve their mental health condition if there is such effect on their mental health.
Yeah, so COVID definitely has increased the mental health issues, and people who have gone through COVID, they are at a higher chance of being in an anxiety mode, because what happened during that point when the first wave and all, when COVID happened, it was almost near-death experiences what they went through. And initially the kind of isolation they had to go through, the kind of uncertainty they had to go through. It was painful, and that repeats. They have this fear that I may get it again. What if I die? What if something goes wrong? What will happen to my children? So there's a lot of uncertainty, and there's a kind of insecurity which has been developed in many people who have undergone COVID. And some people are vulnerable, and it became worse. Like even some of them had got a psychotic episode where they started hearing voices and things like that. COVID definitely has increased mental health issues, and it has kind of changed the way we are looking at mental health now. So what do we do about it is to become very aware that all our thoughts need not be given importance to. Sometimes our thoughts are this overthinking. It's a lot of assumption which comes in our mind. It's our fear which is talking. It's our insecurity which is talking. So we have to know how to deal with this overthinking and able to feel safe that everything is okay and things can be better. You can work on your health, your physical health, your other social life, your emotional life. Life can be beyond an illness too. You have to learn to improve your personality and not get stuck in the fear. So overall, if you develop your personality, I think those fears can go.
Sure, Dr. Safiya, thanks for the explanation. I will quickly take the last question. I know we are up to time. We have a very larger group of people who are working for a longer duration of time on their laptops and mobile. Even the younger generation is on their mobiles and laptops. There is certainly a kind of effect they have, not on the physical health, but as well as on the mental health. So is there something that they can do to manage their mental health? Are there some tips or tricks that you can share with them, so as they can be able to manage their mental health well?
First of all, recognizing what are the areas which is being affected, like what is it which is bothering you. Able to journal it, meaning able to put your thoughts into paper and say, okay, this is something which is bothering me, and able to take it out of your head. When you write it down, you kind of see your problems written and kind of defined. Once you define what is a problem, try and see what's the best possible way to kind of minimize it. You may not be able to stop it, but we can always take small or little steps to kind of minimize those problems and make it a little lesser intense. So try to have that habit to see what best I could do today so that I can reduce this kind of thing which is affecting me. Able to communicate with somebody whom you trust and then see what else solution could be there for this. That helps. And then having a good regular exercise, having a time for yourself. Self-care is sometimes neglected. You need to take care of yourself. You should do what you enjoy. You should have some passion and hobbies which kind of you chase. Learn a lot, read a lot. Knowledge is a good source of inspiration. So all of that will help you have a better mental health.
Sure, Dr. Safiya, I do believe I will take this note, learn a lot and read a lot. That is certainly something that these people do require, a book, a physical thing to, read on. Thanks a lot, Dr. Safiya, for giving us your time. Dr. Jamuna, over to you.
Thanks, Dr. Isha, for coordinating. So thank you very much, Dr. Safiya, for creating awareness about mental health. I'm sure that today's audience would have got enough knowledge related to mental health and well-being, and all will surely be aware of what they can do to improve their own mental wellness and also help their struggling family members and friends. Okay, thank you very much, Sutapa, for your diet inputs. And finally, dear viewers, to avail the benefits of our care plans and diet plans along with the care coordination services, please download the QurBook app from Play Store. We have introduced care plans and diet plans for mental health conditions in the app, especially for patients who have various issues like depression, anxiety, insomnia, stress, eating disorders, etc. We also provide counseling sessions and also customized care plans for patients who are in need of it. We will be very happy to serve you all and your healthcare needs. Kindly contact us for subscriptions and any further queries. Thank you all for joining today's session. Take care. Bye.
Thank you. Bye.